Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have a special guest with us, Sierra Drevline. She is the Director of Employee Health Services for Masonicare. Welcome, Sierra, and thanks for joining us.
Thank you for having me.
It's great to have you today. We have a lot to cover. So let's start with vaccine availability for our residents and employee team members. You are working on that on two fronts. Can you tell us what you're planning?
Yes. So as we move to the flu season, we are coordinating flu clinics in our locations, basically dedicating the month of October to create a convenient clinic time and date for our staff and our residents in order to get vaccinated for flu. Around the same time, we are hearing information about booster shots potentially for everyone who is 8 months out from their original COVID vaccination series. So we are working with our pharmacy partners with whom we've developed relationships over the last several months in order to tentatively plan at this point clinic dates and times for those as well. So balancing those two isn't easy, especially when the COVID booster information is changing a lot. So it's basically just keeping in contact with those pharmacies and sharing information, sharing resources, and really coordinating for the best care for our residents and staff as frontline workers.
It's great. And I just wanted to ask you, I know you're waiting on this specific guidance, but are you hearing that we think it might be that folks who got their vaccine, their COVID vaccine, that it'll be 8 months from the time of their second shot if they got the 2-dose?
That's what I understand. So that's where we're anticipating. Most of our staff that works at the health center and our assisted living communities, they were vaccinated very early on back in December. So we should meet that criteria by that September 20th date as advertised federally. So we're anticipating that.
Great. Thank you so much, Sierra, for all that information. And we look forward to hearing the latest from you. And JP, what are you hearing from our residents and our employees about the COVID-19 booster shots?
Sandy, I've actually received a few emails and calls from some of our staff just asking, when's the booster coming out? We heard it's the September 20th. When are our clinics coming out? So there is definitely an interest from our staff to get that booster. Just yesterday, I was at an event up at Asher Village, and I was approached by many different residents that have asked, are they getting the booster in the time frame that they've heard on the news? And I was happy to be able to say that thanks to Sierra and really the key staff, that we are going to be able to get that booster vaccine out relatively pretty quickly. So it was a warm heart for our residents and even our staff to hear that we're ahead of it and making sure that we're going to be able to get it to them. I think it has been very important. And, I think as we continue to navigate through this virus, the more we're prepared for it, I think the better it is. You've heard me talk very much about light at the end of the tunnel. We're continuing to get close to that normalcy, but we still need to do some of these things, such as the booster shots. And I think many of our staff and many of our residents see that and want that booster as soon as it's available.
That's great news to hear, JP, that will be coming soon to everyone at Masonicare. Also, last week it was announced that all nursing homes will be required to have their staff members vaccinated against COVID-19 in order to continue receiving federal funding. Masonicare has led the way in doing this very early on, and I know this is something that you have felt very strongly about.
And I would first tell you it's about time that it was mandatory for nursing homes. But, when you look back, we made the decision very early, November, December timeframe, that we were going to make this mandatory. And It was a somewhat of a controversial decision to do it, but we knew it was a right decision to do it for our residents and our patients that we serve each and every day. So we knew it was the right decision, and I'm happy to see that other organizations have stepped up. All the hospitals, many of the nursing homes throughout the state of Connecticut have already made it mandatory. So for this to be mandatory from a federal perspective, I think it is good news. But I do think many organizations were already in the leading front to get this done. And obviously, with the FDA approving the Pfizer vaccine as not experimental anymore, I think only solidifies that this is the right thing to do across our industry. And as Masonicare, we've been able to really be out in front of it, and we'll continue to be out in front of it as we move forward.
That's wonderful, JP. Thank you so much. And Dr. Schwartz, as JP was just alluding, we did have big breaking news on Monday when the FDA granted full approval for the Pfizer vaccine for people 16 years and older. Can you share that latest information with us?
I'll definitely try, Sandy. You know, every time we do these shows, there's always some new breaking news about COVID. I did want to just thank Sierra for all her hard work, you know, welcoming her here and, you know, the new role that she has. It's been great working with you. And, you know, it's a lot of challenges. We just got to keep moving forward. And, you know, that turns us to the approval of the Pfizer vaccine. And I do have a nice article here. It actually was a 6-page article I condensed to a half a page just to try to give you the main points of everything. And the title of the article says, FDA grants full approval to Pfizer-BioNTech COVID-19 vaccine, opening door to more vaccine mandates. So this kind of summarizes where everything stands. And, you know, a lot of this are going to be quotes so that you get kind of the up-to-date expert opinions of things. So the way the article starts, you know, as you said, on Monday, the FDA, Food and Drug Administration, granted full approval for the Pfizer vaccine for people 16 and older. And this is monumental because this is the first coronavirus vaccine approved by the FDA, and it's expected to open the door to more vaccine mandates. So this is a quote from the announcement from the FDA. And they said the vaccine has been known as a Pfizer-BioNTech COVID-19 vaccine and will now be marketed as Comirnaty. I don't know if I said that exactly right. Comirnaty. It's Comirnaty. That's a mouthful in and of itself, but that's what they're going to market it as, for the prevention of COVID-19 diseases in individuals 16 years of age and older. And we know that the Pfizer vaccine was given emergency use authorization for individuals 16 and over in December, and in May this was extended to individuals 12 and older. This is another quote from the FDA. It says, the vaccine also continues to be available under emergency use authorization. The abbreviation is EUA if you wanted to know, for individuals 12 through 15 years of age, and for the administration of a third dose in certain immunocompromised individuals. So one interesting piece of information or statistics, if you will, was that out of more than 170 million people in the United States that are fully vaccinated against COVID-19, more than 92 million have received the Pfizer vaccine. And this is a quote from Surgeon General Dr. Vivek Murthy. And he said, for businesses and universities that have been thinking about putting vaccine requirements in place in order to create safer spaces for people to work and learn, I think this move from the FDA when it comes will actually help them to move forward with those kinds of plans. And then he also noted that a small number of people have been waiting for full approval before getting their shot and believes this may, quote, tip them over toward getting vaccinated. And finally, I think this is interesting as well. There was a Kaiser Family Foundation survey of United States adults that were released in July, and it found that among the 1/3 of adults surveyed who were not yet vaccinated, 16% said the vaccine was too new, too unknown or not tested enough. And it was also said some said in this poll that they wouldn't get a vaccine until it was required. So, some experts believe more companies will make it a requirement now that the vaccine is fully approved. So I just want to echo JP's sentiments. I think this is a big step forward for us. We really were on the cutting edge of having this be a mandate early, but this is going to continue to make a big difference in our fight against this pandemic. So now the moment you've all been waiting for, my inspirational quote for the week, which says, "Life is like a camera. Just focus on what's important and capture the good times. Develop from the negatives. And if things don't work out, just take another shot." Now, the person that wrote this, his name isn't that easy to pronounce, but it's Zaid, Z-A-I-D-K Abdelnour. And if you don't know who he is, he's actually an investment banker, financier, and president and CEO of Blackhawk Partners, a New York-based private equity firm. But I like that quote because it just sort of says it all, I guess. So in summary, once again, we just got to keep going in the direction that we are, working together. And again, I thank everybody for all their efforts and hard work, and diligence, and once again, wish you health and wish you peace. Thank you.
Thank you.
Wonderful, Dr. Schwartz, thank you. And I want to thank you all for sharing your time and your insights with us today with so much important information that we wanted to share with everyone. And of course, we thank you for joining us at home once again. Until we see you next time, we hope you'll stay safe and stay well.